Hello everyone, welcome to the next lecture of general anatomy. We had studied our general anatomy where we have covered our axial skeleton, appendicular skeleton. We had studied long bone, parts of long bone, their blood supply, and now we are covering joints. So joints is usually a meeting point of two bones. Joints we have studied in class 12. I'm just giving a basic revision. Also, I would request you all to please study through book and then make notes. It would be better if you make notes on your own. It would help you in your long run during your examination. This is just an explanation of topics which I'm doing. I'm not providing any notes right now. If you need notes, you can comment. I will send you the notes, but it will be better if you attend the lecture, then you study the book and then you make notes. I know it takes time, but it will help you in your long run and will be easier for you to remember things. It is not possible for you to remember things in just one go, like you had attended the lectures, you will remember everything the next day. It is not possible when you go through the words. और ऐसा भी नहीं है कि एक बार आपने ये पढ़ लिया उसके बाद वो words नहीं आएंगे या फिर नहीं, इसी से आपका आगे का बेसिक्स बनेगा, उसी में भी फिर आप उसी को पढ़ेंगे, बार बार सुनेंगे तो वो ऑटोमेटिकली धीरे धीरे याद हो जाएगा. So here we are covering joints. Joints is the meeting point of two bones in the easiest language possible I have written. It is responsible for movement of the body and acts as a shock absorber. We will study about the classification of joints, which is very necessary for you, and it is mentioned in BDC Chaurase. I have exact lines done for you. It's structurally classified into fibrous joint, cartilaginous joint and synovial joint. We will study fibrous joint differently, then cartilaginous joint and then synovial joint. Now we have fibrous joint. In fibrous joint is immovable or slightly movable joint. The immovable term is also known as synarthrosis. So fibrous joint is also known as synarthrosis. The fibrous joint is divided into sutural joints, syndesmosis and gomphosis. Now what is sutural joint? Sutural joint is basically found in skull and is connected through your Sharpie fibers. We've also learned about Sharpie fibers in the parts of growing long bone where the periosteum artery is supplied and they are held together by the Sharpie fibers. That in the diaphysis region we have learned about that. So here we have fibrous joint which is divided into sutural joints, and syndesmosis where the two parallel bones are held together comes under syndesmosis. And in gomphosis, gomphosis is basically present in the tooth region of ours where it anchors the root of tooth. We have first type of fibrous joint, that is sutural joint. In sutural joint we have plain sutural joint, denticulate, serrate sutural joints, shindialysis and squamous sutural joint. In plain sutural joint, it is present between internasal suture. In when we had studied the axial skeleton, I have shown you the internasal region where it is present, the nasal bone, and between two nasal bones there is internasal suture, that is the joint of plain sutural joint. Denticulate, it is present between lamboid sutural region, in the lamboid region. Serrate sutural joint, it is present between interparietal suture. So if you see the parietal region of our head, that is here it is present, the parietal region, two parietal region. This region, this joint is known as serrate sutural joint. We have shindialysis, it is present between the sphenoid bone, that is the butterfly shaped bone, and the vomer region. So between sphenoid and vomer bone, shindialysis sutural joint is present. Now we have squamous sutural joint. It is present between temporoparietal suture. So in the skull region we have all the sutural fibrous joint present, and then it is further divided into plain sutural, denticulate, shindialysis, serrate sutural and squamous sutural joint. The other type of fibrous joint is our syndesmosis. We had discovered the sutural joints and now we are studying the syndesmosis. Syndesmosis is a joint found where there is interosseous ligament, where the bones are connected by interosseous ligament. So when we will study ligament, we will discuss about it in later. Just remember for right now that syndesmosis will be present only where there is interosseous ligament. So example of syndesmosis will be in the inferior tibiofibular joint. We have tibia and fibula connected in our leg region. in the fibia and tibia, in the inferior region, that is towards the lower end, we will have syndesmosis. Also in the medial tibiofibular region we will have syndesmosis. In the radioulnar joint, that is the joint which connects our radius and ulnar bone, we will in the radius and ulnar bone where we will have presence of syndesmosis, that is in the radioulnar joint, inferior tibiofibular joint and middle tibiofibular joint. In the superior region, if you think, it is synovial joint, which we will study later. In the for now, just remember that in superior region of tibia and fibula, we have synovial joint, and in the inferior and middle we have syndesmosis, that is a type of fibrous joint. So here we have third type of fibrous joint, that is gomphosis. Gomphosis is present between gum and tooth. So in fibrous joint we had learned about three types of joint, that is sutural joint, syndesmosis and gomphosis. Here we complete our fibrous joint, and now we will study about cartilaginous joint. So now we are going to start synovial joints. We had completed our fibrous joint, cartilaginous joint, and now we are going to study about synovial joint. Before learning the classification of synovial joint, we need to understand the structure of a joint. This is your two bone, this is your convex end, this is your concave end. These two bones have covering of hyaline cartilage. These two bones are covered by hyaline cartilage, and there is a synovial membrane present over the joint. The synovial membrane has synovial fluid in it. We have two bones covered by hyaline cartilage, then a synovial layer of synovial membrane. This synovial membrane contains synovial fluid all over the region of hyaline cartilage also. This synovial fluid has the function of providing nourishment to the articular surface. Now this region where the two bones are going to articulate, the region of their joining is known as articular surface. So synovial fluid has a function of providing nourishment to the articular surface. It reduces friction. Obviously a fluid will help to reduce friction so that rubbing does not take place between the two bones. It is rich in hyaluronic acid. Synovial fluid provides nourishment to articular surface. It reduces friction and is rich in hyaluronic acid. Now we have a covering of a capsule which is known as articular capsule or joint capsule. Now this articular capsule has a function of preventing excess movement of joint, and the hyaline cartilage, if gets degeneration, if it degenerates, that is if hyaline cartilage degenerate, it will lead to osteoarthritis, and if synovial membrane degenerates, it would lead to rheumatoid arthritis. These two conditions are very important conditions. You will learn about it in your second year, where you will discuss everything about this disease, how its treatment takes place, what are their causes, pathogenesis, and how it occurs, how it is to be treated. So it is just an additional information. Synovial membrane degeneration leads to rheumatoid arthritis, and hyaline cartilage degeneration leads to osteoarthritis. So we have two bones. Now the articular surface is covered by hyaline cartilage, and another layer of synovial membrane is present. This synovial membrane contains synovial fluid which has the function of reducing friction and is rich in hyaluronic acid and provides nourishment to articular surface. The whole structure of hyaline cartilage and synovial membrane is covered by articular capsule, also known as joint capsule, which prevents the excessive movement of joint. So here is the basic structure of the articulation surface of the two joints. This will help us in learning and understanding the classification of synovial joints. So now we will look towards classification of synovial joint. Synovial joint is the most evolved and mobile kind of joint, that it has high mobility, movement. Synovial joint is firstly classified into plain synovial joint. Plain synovial joint, that is, it has flat articulating surface. When we have two bones, the point where the two bones are going to connect to each other is known as articular surface. So that in plain synovial joint, it will have the flat articular surface, and there will be gliding movement takes place. That is gliding towards each other. that is intercarpal joints. If you look at the two carpal bones, you'll realize that it has flat articular surface and it shows only gliding movement. It is visible in intercarpal joints, intermetacarpal joints and superior tibiofibular joint. We have learned that fibrous joint is present in medial and inferior tibiofibular joint, and the superior is present in plain synovial joint. So plain synovial joint has flat articular surface, shows only gliding movement, and its examples in our body is intercarpal, intermetacarpal and superior tibiofibular joint. So in intercarpal and intermetacarpal, it also includes intertarsals and intermetatarsals. It is as same as carpal and tarsal. Now another type of synovial joint is hinge synovial joint, and it shows flexion and extension movement. If you look clearly in hands, this is your flexion movement, this is your extension movement of elbow. So elbow joint is the example of flexion and extension movement, that is hinge joint. Also ankle joint shows similar kind of movement of flexion and extension, classified under hinge joint. Interphalangeal movement, this kind of movement of interphalangeal movement, hinge joint. Now condylar joint, it has articular surfaces, that is the point of meeting of two joint articular surfaces forms condyles, and it shows flexion, extension is flexion, extension and rotation. Elbow joint can't show rotation, therefore it comes under hinge joint, but condylar joint shows rotation, that is knee joint. Knee joint shows your flexion movement, extension movement or also rotation movement. And temporomandibular joint, TMJ, it is also known as TMJ joint. The next one is saddle joint. Saddle joint is the joint which shows all kind of movements and has, that is sternoclavicular joint, that is between sternum and clavicle. Calcaneocuboidal joint. Ellipsoid synovial joint, it is elliptical structure. This joint has elliptical structure and has all types of movement shown, that is wrist joint. In wrist joint we have elliptical structure. If you see clearly, it shows all movement, flexion, extension and rotation, everything. Atlanto-occipital joint, that is yes joint, the joint between your occipital region of your bone and the cervical, that is atlas of your bone. It will show that it will come under ellipsoid synovial joint, and it will show the yes movement and will help in yes movement. We have learned this in class 12, so it is a bit easier for you. Pivot synovial joint, it will show only rotation, where there is the single axis and rotation takes place around that axis. That is in superior and inferior radial ulnar joint. This is your radial ulnar joint. It will show movement like this, pronation, supination. This movement will take place in radial ulnar joint, that is pivot synovial joint. And there is a presence of peg in the central bony region. Then the articular surface, you will have a peg kind of structure present in between, that is in pivot synovial joint. It is present in atlantoaxial joint also, that is your atlas, between your atlas and your axis region. Ball and socket joint, it shows all the movement and is present in synovial. Ball and socket synovial joint shows all kind of movements and is present in shoulder joint and your hip joint. So here we complete our synovial joint. So we have completed our all three kind of joints, that is fibrous joint, cartilaginous joint and synovial joint. We will revise our classification of joints. That is, first one was our fibrous joint. Fibrous joint was further divided into sutural, syndesmosis and gomphosis. Fibrous joint divided into sutural, syndesmosis and gomphosis. Sutural was again divided into plain, serrate, squamous, denticulate and shindialysis. It is found basically in our skull region. Syndesmosis is the union of two parallel bones joined together. Gomphosis, its function was to anchor tooth and gum, which is found here. Cartilaginous joint, synchondrosis and symphysis, primary and secondary cartilaginous joint. Synovial joint, we have got plain synovial joint, hinge synovial joint, condylar synovial joint, ellipsoid synovial joint, saddle synovial joint, pivot synovial joint and ball and socket synovial joint. So here is the classification of joints. Basically, it's important to learn the example. It will help you in memorizing again when we will study the joints.